everyone, my name is Danielle and I will be telling you about a disease my mother has that is called fibromyalgia. Have you ever had those days when your whole body just hurts and you feel like someone has beat you from head to toe? This is how most people who have been diagnosed with fibromyalgia feel like every day. About 3% of the US population suffer from fibromyalgia, a medical disorder characterized by chronic, widespread pain and allodynia, which means to feel pain from a stimulus that does not normally provoke pain. Even though many people have been diagnosed with the disease, it is still known to be one of the most misdiagnosed and misunderstood illnesses that have yet to find a universally accepted treatment and cure. So today I will be informing you about the many symptoms, causes, treatments, and difficulties faced by those like my mother who have been diagnosed with fibromyalgia. First thing to know about fibromyalgia is the many symptoms they can have. The main symptoms of fibromyalgia patients are long-standing body-wide pain with defined tender points, which are muscle and joint pain on the back of the neck, shoulders, sternum, lower back, hips, shins, elbows, and knees. Patients also have symptoms of abdominal pain, anxiety and depression, tension or migraine headaches, dryness in the mouth, nose, or eyes, fatigue and stiffness upon rising, hypersensitivity to cold and or heat, irritable bowel syndromes, numbness or tingling in the fingers or feet, painful menstrual cramps, palpitations, incontinence, and reduced exercise tolerance. Most fibromyalgia patients also have many difficulties maintaining sleep or even light sleep, and mostly have the inability to concentrate. Now that I've told you the symptoms, I will inform you on how most fibromyalgia patients are diagnosed and treated. Diagnosis of fibromyalgia requires a history of at least 3 months of widespread pain and tenderness in at least 11 out of 18 tender point sites. Sometimes, laboratory and X-ray tests are done to help confirm the diagnosis by ruling out other conditions that may have similar symptoms, such as rheumatoid arthritis. Age and gender is also put into consideration with diagnosis, since fibromyalgia is most common in women from ages 20 to 50 years, though men and children can get fibromyalgia too. Although fibromyalgia can be checked by the many different symptoms, there are still no specific medical tests available to properly diagnose fibromyalgia. Now, the hardest part of treating fibromyalgia is the fact that the disease has no known cure yet. So patients are given many different medications to help with pain, sleep improvement, and to manage depression and anxiety. Also, many patients are encouraged to do daily exercising, both strengthening and aerobic conditioning, to help improve fitness and sleep, which may reduce pain and fatigue in some people with fibromyalgia. Relaxation therapies such as deep muscle relaxation or deep breathing exercises may also help reduce the added stress that can trigger fibromyalgia symptoms. Finally, the suffering of those afflicted with fibromyalgia is serious, and it is compounded by the failure of the medical profession to understand this disease. For instance, diagnosis for fibromyalgia often takes 3 to 5 years to be established by many physicians due to the fact that it is often unacknowledged as a real disease, saying that it is just all in your head. Also, roughly 1/4 of people with fibromyalgia are work disabled, and approximately 50% have difficulty with or are unable to perform daily routine activities. So despite of being recognized as a diagnosable disease by the American College of Rheumatology, the Food and Drug Administration, and most insurers, fibromyalgia has not shed the stigma of being dismissed as psychosomatic by many people in the medical establishment. In conclusion, I want everyone to know that anyone could have fibromyalgia, that it is a real disease that affects millions of people around the world and should be acknowledged as one by everyone. I hope that this speech has helped you to learn what fibromyalgia is and has given you a better understanding of what fibromyalgia patients like my mother go through every day. I thank you for listening today. Do you have any questions?